530, right? 530, yeah. I only have one axis and one let me see. So tomorrow we will have the protocol presentation, and therefore it will occupy about the whole lecture hour. So instead of taking the whole lecture hour, and our friend, I don't want them to say our meter has after engineering, you can get different type of the domain for fragments. Therefore, today we technology. Now they are not only can come up from the Y shape. Now, if you want to target on this only the FAB or the FC, okay, we can easily, like for example, the Y commonly used is the SCFP or the SCFP are changed, or we call that is, or another one is FAB. Okay, these are the very commonly used in the in most of the laboratory. And if you find that you still want to get a smaller antibody, of course, that you can go to find the single domain antibody from other animals. Alright, for example, from camel, okay, you can get it from shark. So my lab also working on this single domain, and we get it from shark. And at this moment, we are constructing a new library for the camel as well. Right, it's a single domain. Why you want to use it? Because we are looking for a more stable and more smaller antibody which can easily to penetrate to the cavity region of the antigens. Just to imagine that antibody is like an arm. It's covered with the palm, right? So if you want to touch the like for example, if this is a basketball, right? You want to touch it and then you need your hand into it. But if for example, if this is a golf ball, and you know the golf ball, they have so many loops, a small loop, and maybe there's some dirty, and then you want to scratch up the loop, can you use your hand and then to scratch like this? Hardly, right? We can't need to do that. So we need to come out with a new solution where we need a smaller antibody fragment to scratch the dirt up. So this dirt is mimic like the antigen, the crack. That is what we want to do. What kind of the application you want to use. Alright? So we can turn it out into a small antibody and turn into your application. Although we are using the camel, shark, chicken antibody or anything else, finally, if you want to turn that into the target, now we have because we have a process name as humanization. Now, uh, here I list the table for you, but I just want to have something in the advantage. Polyclonal, many industry or in medical field, they prefer to use because they are expensive to produce. So cell culture. Put this as a flow, but this flow become the the negative, the advantage of the polyclonal. The other advantage of the polyclonal is what? It can recognize the multiple epitope. Okay, it can recognize. For example, now linear protein, linear, you know the linear, they have a lot of this. They have so many types inside. Of the polyclonal is what? Because best to best will handsome. I don't know handsome or not. Right. Okay. Alright. So hybridoma happened in 1960. Not for one delivery because before 1970, until years later, the Nobel Prize winner, Great Winter from UK, Cambridge Uni, and he pioneered to technique to humanize the first monoclonal antibody in the world. One technology only able to produce a mouse antibody, 100%. All right. If you want to apply this antibody in the human, they try to make the first humanized antibody we call CDR3 grafting. Grafting means that they try to take most of the fragment of the human antibody to put in the mouse antibody. But the sensitivity only can maximum go up to 95%. So what's that? The really the really So after a few years later, this who else are some of the this gentleman Greg Winter, Professor Greg Winter lah, related to this guy. He able to produce the first 100% human antibodies using his method. Okay, using his patient. So actually, it's a very old picture. No matter they are in a naked MAB, but after you have a modification of the format, it can turn into the radiation cytokine. You can use for the immunocytokine, immunotoxin, or either you want to use for the bispecific, everything can be. Bispecific become possible. It's already there. New drugs. A new drug. But in the Edward journals in the 18th century, he so he respected the first more mechanism. Antibody, they are all the same. So until to 1975, just like I said, the invent of the hybrid technology. So it's a new time for the monoclonal antibody to fly market. Until 1990, the antibody engineering technology start to work. And the technology is going to be a bad thing, right? So after this 1990, you can see onwards. Here they still have this one is 3 pictures, and then they still have some pictures. Until today, 2024, there are a series of the new drugs entered with the NDA. So you can look at here. This trastuzumab, this MAB, this bevacizumab, ramacizumab, map, everything map. You can see MAB entered here. All this what? Many years ago. The everybody is body with so it's a very specific. It's very specific to a unique antigen. So it possesses the antigen binding site and members of the cluster of this protein is an immunoglobulin. Okay? So they are all in a Y shape. Okay? They are all in the Y shape. And this Y shape it can be divided into 2 parts. One is a variabilism. Okay, and the other part is a constant. This variabilism is the most important part if you want to use to capture your antigens. And therefore, if you want to discover an antibody only used for the diagnostic, this part is not that important. Because we only need that to capture your antigen. But if you want to discover an antibody, it can be trigger your immune system. And this F season part under the conservation, right? So basically, the antibody can be divided into two identical heavy chains, two identical light chains, and each heavy chain has a constant reason and rubber reason, and similar to the light chains has a constant reason and a rubber reason. So these pictures, I hope that everybody can put your mind. This is a mouse, human, they are using this one. But for the chicken, different. Chicken, there's another part here. It's a longer part. Okay? Because the cow, they have longer pH. Okay? They have longer pH. Just like this is the variable reason. VHBL. V stands for variable, C stands for constant. The constant reason here, basically, if you want to use for the diagnostic, normally for me, I don't need the constant. Because if I can remove the constant, I only keep this VH, it will make the antibody size more smaller. Yeah. So you can able to so antibody, if you go into details, can be like this first part, okay, can look here, don't look at the tail cell first, look at the body. This is the variable, this is constant, and above the arm part, we name that as a FAB, antibody fragment. FAB stands for antibody fragment, and the size of the antibody fragment, variable plus a constant, total is 50 kilodalton. But this FC is a tail here, also 50 kilodalton. And the F reason here is about 25 kilodalton. But after you total up the whole antibody, after you plus here and plus here, plus the linkage everything, the total is good, but either you want to only use a FAB reason, the size is only up to 25 or 26. Alright. So you can see later you might be asking me, sir, why the paper they will write in the SCFB, they are not only FB. Of course, they are all in the FB. The SC. The FB, if you want to produce only the VH or only the VL, what use FC basically is a fragment constant, and they are used to trigger the different kind of the immune system. Okay, they kind of like just like I mentioned about the ADCC and so on. So where is the part to let this antibody can bind to your antigen? They are in the very detailed part. It's only focused in your VH only. VH and VL, the variable part. These two parts, they will have this. We name it as a CDR1, 2, and 3. Okay? Complex determination. complete determination region of the antibody. So see,
Tuh, sama.
the main tool. So yeah, and that's them in the single chain. These are something like this linear format. It will be divided into the CDR1, CDR2, and CDR3. Okay? But because they are fold together, it turns into this shape. CDR3, this part is the longest. And this part, just imagine they have at 26 alphabet. But in 26 alphabet, they are not A, B, A and B, Z in the sequence. In this antibody, it can be A, B, C, okay? Uh, because we play around the CDR3 line. Okay. Then just now what I said here, oh, all right. So that's why I say it's a relevant factor. It's a type of antibody and it aims to bind to a different type of antigen. And the specificity of the antigen binding determined by the VH and VL. VH for the available, M stand for the from the antibody. This part we need to combine them with the FC and therefore we think now select the function neutralizing, obstruction, okay, neutralizing, compression of activation, agglutination, and antibody dependent cellular ABCC. Okay, these are the more common. And many of the drugs nowadays they have another things I never put here is what is called ABC. They inject in the body, this antibody will go to fight this cancer target. Then later, the payload, the drug here, will throw into this cancer cells. Automatically, they release into the cancer cells, and then will destroy the target for the cancer cell. So it won't kill any healthy cell. Okay? Many years ago, and somebody Better cellular cytosis. Divided into the IgD, D, A, F. G for delta, A for alpha, E epsilon, and F for can compare lah. But most of us, the IgG is the most important in the body. But basically, if you have any um, outsider come to your body, as they come up by the IgM first. So this data for you, I don't want to go. Now I want to go into hybridoma. You need to immunize the mouse. If you want to produce this hybridoma, okay, this hybridoma myeloma cells, all of them are derived from mouse. Okay, so the first thing is what? Until right now, human ones still not yet developed. Okay, 2 years ago, I've been listening to first first MAB production using hybridoma. You need to use a mouse, immunize the mouse will produce its own antibody from the B cells. So you will collect the B cells from the mouse and then get the myeloma cells. Okay, myeloma is cancer cells. Let them to combine. We name that as hybrid. And therefore, after this B cell and the myeloma cells combine, it named as a hybridoma. Okay, so when this hybridoma, after that we will do the HAT selection. You put in the single cell into the single well here, and then we will strictly do a screening ELISA. So the ELISA means that you put the antigen to see which cell can respond to your antigen. Once the screening, the hybridoma screening done already, then we will, for example, how many wells they come out, we will take out the cells, and then these cells they will start to produce the antibody on the surface here, and the antibody producing hybridoma clones. So you will take this clone, filter it, and purify it, and then you can get a purified antibody. This is the concept. you can see the results. That's in your myeloma cells. Okay. After combination, if this okay, they will come out the papilloma. Then after the oligohistidine selection, parameter healthy or not? Papilloma healthy or not? Another thing is, how about your medium? Are they okay or not? You do the explanation. You look at this, it just seems like so simple. Actually, I tell you, it's not simple. But I would like to working out certain time, but not very often because especially for the cell culture stuff. Um, yeah, has the capacity of antibody drugs derived from the B cells. At the same time, it can divide continuously by quantity derived from the iron cells because they are by combining the desired quantities of both cells and the diagnostic and so the last quantity, last antibody. I can show you here. I just want to one more time. The homogeneous things and they're all same. You won't have just any back to back variability. Okay, and they are specific. Of course, this is what we want, and it can be used as an immunizing antigen. Anything can, and then it can help, and then you can use it to immunize your antibody. Then easily to do selection and antibody. This is one advantage of the MBBs. But the limitation is what? The limitation is, more importantly, is there's not any practical way to alter the properties of antibodies produced. Requires specialized cell culture facility and has a medium. This is the medium. You can use Now we name this antibody vaccine everything under this term, biologics. Biologics. And this biologics start to replace the last molecular drug. Okay, last molecular. Then before the drugs come out, people would say the aspirin, the small drug, the easily, but this small drug, why they not so advanced now? Because we haven't been able to vaccine. But they're complex. The complexity, size and complexity of the drugs and proteins is become an issue in the last about last decade, okay, 10 years ago. Okay, but now today the science is coming ahead. Display technology basically is there are three steps. Don't look at this diagram. This is my published one. That's very nice. Okay. The first step is library construction. You need to construct a big library contain high diversity of the different antibody. Then later we go to selection. And this selection, in this way, we name it as a biopanning. What does it mean by panning? Panning, last time, if anyone happened to have a normal Display put another word called bio because we want to use it. So we need a bargaining. We will repeat this painting few times, painting few times, so few times. Then the last part we will do. Come back to this clone and then we will taste the gene out, start to do the antibody. This is basically it construct the antibody gene and then to transform into this the whole things of this one because they are all in the vector. They're all in the vector. So if we need to design the vector in, then transform the whole thing in this in different traits. And when you prepare your library, randomly selection, they will have thousands of these different vectors. Million of them together. So after they already transform this antibody gene, then this whole entity they will automatically present your antibody on the top here. And this one we name that as a display antibody part. Okay. So later we will take this whole thing. This is only one. If they have 1 million, means that the repertoire is so big. So this in the antibody library, it will have more than 1 million of these different antigen phase display. Why we want to name it as a phase? Because this is antigen phase. Therefore, this selection, this method, we name it as a display. And display what? Display your antibody here. And this is called phase display. Okay? Understood? So basically that it can be divided into genotype and the phenotype. Genotype means that can contain the gene. Phenotype means that this is an antibody. What is this? This because it contains a vector in the fudge. This vector we can pick up. And when this weight, we need this vector in the bacteria, we need it as plasmid. In the phage, we need it as plasmid. When the plasmid is picked up, you can keep for how long you also can. It means that you only need to produce the antibody. Maybe you say the company you sign a contract after 10 years, they want to license the antibody. So after 10 years, the antibody is still there. The phage, you won't be so. Second thing that I want to say here is you easily to trace back. For example, after your selection, after biopanning, you know that this page they present the antibody that you want. Right? So I will take this page out, amplify this page from 1, amplify into how many? Okay, I can amplify just 1 point to the E. coli and then you can amplify. Oh, just 1 necrosis. And then you do the phasing purification, you can get a lot of the same phasing. This one. Then then they will present the antibody at the tips. Alright, so if you know this antibody can help you just go to antibody and more easy to maintain. Right? The weight of the biopanning. Okay, biopanning is that I don't want to repeat because If you want to understand this one, you need to hands on. But I can repeat the principle for you. So the first one, this is a library. You can see the library got the purple color, blue color, green color. You don't know which fudge antibody can bind to your target. So you put the whole library to do the selection. This is your antigen. Okay? What maybe the purple color can bind to an antigen. Then you will wash away. Why you need to go to wash? Because you need to wash away the blue and the green one. You only need to focus the purple color. Why we need to go 3 to 5 times? Because we need this purple color and the first antibody to 3 to 5 times. Behind is only the purple color. So after left behind the purple color, we send this sequencing out for what? After elution, you will do the plating, put on the ELISA. First, it means that it can recognize. Alright? So if they can recognize from here, just like I said, the face is still there, you will send this face up to do the sequencing. Right? This one library, antibody library, you can either produce we use a synthetic. So divided into display, but phase display is still manually just the easily set up. Okay, so this is the antibody. They can be divided into the phase 1, phase A, B, C, D. Okay, the A means that it's an antigen selection. Then it's a similar things like then we want to know the target cDNA and then to produce the for the antigen production. Then once you got the production, they will produce in the mice, and then this one is for them to do the hybridoma testing. But in the pharma industry, it can be more complicated. It's not like what we do. Okay? In our lab, we are doing the in the pharma industry, they have so many different. We call this as a milestone. Their milestone. Okay, their milestone, or sometimes they name it as a kind of the different kind of the target. This is called what? There are different milestone or different target objective in their whole pipeline. We call it as a pipeline. Okay, this is the whole pipeline. If you want to produce an antibody or any kind of biologics in the pharma industry, they have so many pipelines. When you like for example, you start from the market identification, verification market already, you got your validation, then later you need to have the testing to prove it. Then after you prove everything, verify everything in the lab, next you need to go to the clinical development. If you can, next step you need to get the regulatory approval. For the commercialization is the last part. So for this process, This video. Sleep is the best way to produce the human. But my lab, because we only produce our antibody cells in a very small size, we focus on the bacteria because bacteria can help you give you. But if you want to get the low cost, bacteria also low cost. Mammalian is the highest cost. That's why I said anything you touch about the cell culture, you need to like this already because it's very expensive. Okay, then FDA approval. Until right now, they only approve mammalian. If the protein or antibody produced by the E. coli is good, they will consider. But for the PTM, the best one is still mammalian. So you see how many is the mammalian picture here. So mammalian is still the best one. You can see that this is a name. Erucizan has a name, this is a name. But the genetic name for this antibody is like you can see rituximab, transuzumab, emtrozumab, simtuzumab, everything a map one. Right. So FDA approved, I believe that this one is still increasing. Okay, but about 34 of the drugs approved by the FDA, they are already used for the cancer treatment. Then when they feel used for the infectious disease, this bar start to expand again. What by this two gentlemen, Professor what for new cancer marker, cancer marker for this antibody is and then after this after this discovery, nowadays you go to many before, right? Yeah.
Yeah, from the special hospital. Yeah, from the hospital.
Because
now found large fund. Now found large fund in the Green Bank, International Green Bank, about study. Yeah. International fund. Yeah. International fund, the new NDB, Green Bank. After this, called Emirat, you know, called Emirat. The effective change of the cancer, yeah, found the international green bank. This green bank now found is very large money economics about study.
I see, I see, I see. That's good, that's good, that's good.
We work with the international with NGO. Yeah,
Oh,
yeah, yeah. Before the 6 months, now they found the large activation in Emirates or now in some country. Yeah. Now found prepare the activation in my country about this. Yeah. Yeah. Okay. Tomorrow you examine. Yeah. Yeah, my very better now. Yeah. Different. Victor Shahide, with you.
I don't drug. I don't drug myself. Yeah.对，为什么你这里呢把这个？因为只有它有些跟癌症相关的东西，发现，但是这个不包装了，它只是它的这样的下来。
Because my protein is a new protein. Why don't we point? Tell me a person.
Ja, mooi man. Eu entendo como é o planeta. E legal,这个不是，这个是一个主要是国家级的比赛上，他们的性格型的成了嘛，只要写那怎么说？你在讲什么？你都已经好，只有晚餐在煮，不需要这么长，零点基本大家懂的了。你只要知道是中等肌肉的人生，从几到几 OK，人家就知道了，不需要跟人家讲哦，我是0.7。然后这是什么食吧？要看他24小时的食吧。这个也要就是这个你需要讲，你必须要讲什么？或者说是讲这个事的话，这个是大概。这个其实哈，我们在做大学的时候，在这个艺术中用这么仔细的去看了东西，不要的，我们也看了很多，大概在我目前在大学所做的那个15分钟，在我们写作是非常的。所以我来跟这里2个东西吧，第一个是我的每个月是搞然后我怎样做，我就这样没有说到很说哦，我要用这个东西，我就大概从这样子，然后再讲 OK。这个是小赛，处理完就加这个，这小赛跟它起，检测它那个都是所以比如说挖土，第一个它就代表谁点入了，所以不要大概很到都给谁不能，我也写都写在那。大概写如果讲关可能就在好这个是消息。
我选这么多地方，这个就可能是，
是是哪一个？先是癌症，是一次多做，一次多做3个，
你就在就是按这个学时候都3学了，
那我猜是哪？癌细胞，那还有没有？抗癌嘛，然后这个你不要给他，因为本身癌细胞这样子有没有？你现在是那个还是我已经反驳了，就是说他一定会，我比如说啊，我做这个 S A 过后，我讲他那个地方都是那个 cell 那个你的细胞会从这个应该是那个地方，这里 positive 都是
这样子呀，
没有这个是个本我当然要记。
但是我在这个很少，
因为如果你这一个做出来，它可以大商议有对这个有商议，原来是没有意思啊，你们对，你是不是步骤一再做出来是不可能知道？一次多做3个一起做，这个不能全部做。
Everyone is work on this. I have opposite.
那等下老师也教那个，就是他说要分，我比较分一点啊。这样才好听。就是说呢，如果我这样，那我在这一个 step 就是说，你的这个药是有作用的。
不知道所以你要做，
对，它的比如说这个药，我要把它放在这个，我一定要我不知道这个药这个作用，所以我一定要有第一个它的第一个就是它第一个一定有作用。没有。